Hi, good afternoon. I wanted to take the time to respond to your video and really tell you how much I enjoyed your response and how I like how you emphasize that this is an ongoing situation instead of treating it as a one-time event. There's going to be a lot of moments of reassessment as new information emerges. I think that you did a really good job because you also mentioned that someone's behavior can quickly change, especially when they're under the influence of drugs or any substances, or they can be experiencing a mental health crisis. And then I also like how you pointed out having security nearby without having them immediately take on the lead, just having them at the side in case something does escalate. We have the opportunity to have them come in and take role if that's what they need to do. I think that approach helps create a safer environment while also allowing the healthcare team to build a rapport and de-escalate first and do what they have to do. The lecture also highlighted how important it is to recognize the warning signs early instead of waiting until someone becomes physically aggressive. And then by having a plan in place before the situation escalates, the team is usually much better prepared and they much better know, the position that they're going to be in, so that our goal would be to protect the most human life that we can. So I think having a plan in place can really help get us as organized as we possibly can in a situation like that. And I also agree with moving Knox to a quieter area away from busy waiting rooms whenever it is safe to do so. Reducing noise, stimulation, and the number of people nearby can sometimes lower stress and decrease the likelihood of the situation becoming more vital. And then another point that you pointed out that I really appreciate was how you continue to focus on Knox's medical needs throughout your response. Sometimes it's easy to only focus on safety concerns, but patients still deserve the appropriate care and appropriate mental health, medical evaluation and treatment, regardless of their behavior, of their history, of their past, or how they're coming off. They still deserve to get the proper medical care. And I also thought your discussion of balancing privacy with staff safety was important because team members need enough information to respond safely without unnecessary sharing personal details. And I think you responded really well. I think you were able to focus on balancing safety, patient rights, and early interventions, which are all definitely key parts of how to handle a situation like this in a healthcare setting. Thank you.